Hello, I am Mike Foulis. I'm a visiting professor at Strathclyde University, attached to CELCIS, the Centre for Excellence for Children's Care and Protection, and before that I was Director for Children and Families in the Scottish Government. When I took up the role of Director of Children for Children and Families, that was back about 2011, and at that time in Scotland there was a great pressure around about improving the early years. There was all the research and adverse childhood experiences and so on, lots and lots of stuff about that. There's a great interest in prevention, and I have sort of ferment building up of desire to really make a change and try and establish programs, systems, processes, things happening in the early years that would give children a better start on life. Nobody quite knew what to do about it though. And when I came in, the thing that people were trying out was protestations of faith. So we get people to sign declarations about how committed they were to the early years, and they would give speeches to that effect. They would commit to all sorts of stuff. They would attest about how deeply they believed in it. But after they'd done that, kind of nothing much happened. Everything was just going on the same way as it had gone on before. So my job was to try and make something happen. You turn all this commitment to good things, positive, worthwhile goals, and actually try to achieve something. And I spotted sort of two things. One, the first phase was that I spotted that in the area of health in Scotland, in the NHS, a programme had been running to address patient safety, and it had achieved dramatic falls in harm to patients in hospitals using something which is called improvement science, which I think of as a cousin or even a sister of implementation science. So it seemed to me that this was an approach which, things happened when you applied it, and so why don't we apply it in early years? So we started doing that, and that was an interesting experience. No one had done it, had tried to do what we were doing in that sort of field in the world before, and it's the sort of thing that maybe only would have happened in Scotland. There happened to be at this phase in Scottish history quite a broad measure of rough agreement on what the objectives should be for society, for what the political system should be trying to bring about. So there wasn't, in some important areas, there wasn't a lot of party political fighting, and that meant it was possible to develop solutions that people would get behind. So I saw an opportunity to apply this method. At a point, it started to take off. So we got something going. Things were happening. There were ideas being developed around about how you encourage parents to read to their children, for example, which were tested and then spread around the system. There was a thing called the Daily Mile, which some people may have heard of, which started up in the system. It's an idea a teacher had to get people who was in a primary school to run a mile around the school grounds in the morning, and that had big measurable effects on concentration, behaviour, a whole bunch of positive things. And that was tested, and that spread throughout the country. So that was going on, and that felt positive. But the thing that was worrying me was the cultural sort of barriers, cultural dynamics between the different fields that we have here, and in particular the improvement science having been manifested in Scotland in a health background. That people not in the health background were then less likely to want to look at it because it had a health label on it. And coming relatively late to both health and social services, I thought this was quite funny because they had so much to learn from each other, so much that they could give each other. It just seemed to me that the problems one was grappling with, the other had the answer to, and vice versa. But it was very difficult to bring them together. So the other big sort of epiphany moment was Jennifer Davidson of CELCIS had invited Melissa Van Dyke, big implementation guru, over to give a lecture. She gave a lecture in Strathclyde University, and I was just so struck by how powerful it was, how persuasive, and also how beautifully pitched it was towards the social services culture in a way that the other thing we were doing hadn't been. And so I thought, this is what we need to do, is bottle this stuff and bring it to Scotland and then persuade people to drink it. So Jennifer, through CELCIS, got Melissa over, and that's the rest is history, as they say. If you want something to happen, then it's worth thinking about. If you don't want something to happen, if you're happy just kind of carrying on and keeping everything the same, and just rolling on like that, then no, it's not worth putting the effort in to learn this stuff. But on the other hand, if you do want to achieve something, and you want to achieve something significant on scale that will make a difference to the society you live in, or the community you live in, wherever it is, then it's worth having a look at this stuff, because it's, amongst other things, it's the distillation of all we've learned from trying to do this stuff, and often not very well, and failing for decades. So that's really quite important. Why keep on making the same mistakes? We do that. We can actually learn from people who have very kindly already failed for us and have worked out why, and have come up with some useful pointers from us. We can stand on the shoulders of all these people that went before us. So that just seems to me, it would be hard to come to the conclusion that it wasn't worth doing something like that. Sometimes everybody's just more comfortable if things just kind of carry on, and nothing actually happens. But if you do want it, if you do really want something to change, then A, you need a method, and B, you need commitment. And with this body of science here, you get knowledge. You get knowledge and experience from elsewhere, which is on your side.